You didn't see that coming. So this is me again, Jasmine Miranda from BSN Level 3, Block 1. So for today's vlog, we're gonna talk about chest physiotherapy or postural drainage. So first, what is chest physiotherapy or postural drainage? Chest physiotherapy uses gravity and percussion such as clapping to the chest and to the back of the patient to loosen thick, sticky mucus to the lungs so that it can be removed easily by coughing. So what are the two main purposes of this chest physiotherapy? First is to maintain the airway patency by removing mucus and encrusted secretions. Second is to help the patient breathe more freely and to get more oxygen to the body. So what are the nursing assessment in performing chest physiotherapy? First is to assess your client's level of consciousness, level of knowledge, and understanding. Second is to assess your client's vital signs and breath sounds or any signs of symptoms of respiratory distress. And lastly, assess client's area of ribcage over affected bronchial segment to determine whether percussions or vibrations were contraindicated. Now for the planning. First is to gather and prepare the following materials. So let's move on to the procedure. First, you have to check and verify the doctor's order. Second is to identify the patient using two patient identifier, which is the patient's full name and his or her birth date. After explaining the procedure to the patient, perform hand washing and put on PPE if indicated. Don't forget to close the curtains and close the door for the patient's privacy. Use a specific position so the force of gravity can assist in the removal of bronchial secretions from affected lung segments to central airways through coughing and suctioning. The patient is positioned so that the disease area is a near vertical position and gravity is used to assist the drainage of a specific segment. The positions assumed are determined by the severity, location, and duration of mucus obstruction. The exercises are performed 2 to 3 times a day before meals and bedtime. Each positions are done 3 to 15 minutes. Always remember, procedures should be discontinued if any abnormalities may occur. Bronchodilators, mucolytics agents, water or saline may be nebulized and inhaled before postural drainage and chest percussion to reduce bronchospasm, decrease the thickness of the mucus and sputum, and combat edema of the bronchial walls, thereby enhancing the secretions removal. Perform secretion removal procedures before eating. Make sure the patient is at comfortable position before the procedure starts. And also auscultate the chest of your patient to determine the areas of drainage. Encourage your patient to perform diaphragmatic breathing throughout postural drainage. This helps widen airways so secretions can be drained easily. And lastly, document the procedures and the observations to the client's chart. That's all. Thank you.